Exercise is medicine. Engaging in regular physical activity can help to prevent and manage more than 20 different medical conditions. But how much should we be doing to get these benefits? If you're between the ages of 5 to 17, at least 60 minutes of moderate to vigorous intensity aerobic activity every day. Most should be aerobic, but should also incorporate some activities that strengthen muscle and bone at least 3 times per week. If you're between the ages of 18 and 64, at least 150 minutes of moderate intensity aerobic activity each week, or 75 minutes of vigorous intensity activity each week, and muscle strengthening activities on 2 or more days a week if you're over 65, the same as the guidelines for the age group 18 to 64. Plus, aerobic activity should be done in bouts of at least 10 minutes, and activities that improve balance on 3 or more days a week. What is moderate intensity versus vigorous intensity activity? Moderate, you can talk, but you can't sing. 5 to 6 on 10-point effort scale. Vigorous, difficulty talking without pausing for breath. 7 to 8 on 10-point effort scale. Getting started. Break your daily amounts into bouts of 10 minutes at a time. Increase time first and gradually increase intensity. Join friends to make it more fun. Do things you enjoy. 1 minute vigorous intensity equals 2 minutes moderate intensity. 150 minutes equals 21 minutes a day for 7 days, or 30 minutes a day for 5 days.